My name is Louisa Chenciner. I'm a public health doctor. I'm also a junior research fellow at the Centre for Personalised Medicine and an honorary research fellow at the London School of Hygiene and Tropical Medicine. And my talk today is about when climate change gets personal, which of course it already has, and approaches to communicate climate health to the individual. So I'm going to take you through a little bit of background. We're going to discuss about how we talk about climate and health, when to talk about climate and health, and a little bit about the moral and legal imperative. So I know that everyone in the room will be aware of this concept of global warming. I think what's really important to stress is that even at this point, if greenhouse gas emissions decline, we know that temperatures are expected to rise until at least the mid-century. So we know this is happening. It's happening now, and it's going to continue. All scenarios at present pose some risks to health, and we need to start to think about the fact that climate is the context in which we'll need to protect health, all of our health, and that it affects a wide range of health outcomes, as Sarah described, but also broader social determinants of health. And we know that mitigation and also adaptation are required to avoid adverse impacts, but some of these actions might also have unintended consequences for health. I think this is quite a powerful image. This is from a community arts project in Nairobi in Kenya, and just stressing again this idea of climate as context to health. Actually, this isn't a new idea, but I think we need to emphasize it again. And you can see here the interrelation between human health, animal health, environment, nature, climate, all of it interconnected and interrelated. This is more of a technical schematic showing a similar thing. So along with rising temperatures, more extreme weather events, rising sea levels, and also increasing levels of carbon dioxide, we can see there are different domains which have quite significant impacts on health. So these include air pollution, changes in vector ecology, increasing allergens, water quality impacts, water and food supply impacts, environmental degradation and impacts on how societies and people live together in conflict, and also lastly, extreme heat events. I think it's really important in any talk when you talk about climate to think and to talk very seriously about climate justice and health. So number one, the impacts of climate change are not equally distributed, and the responsibility for climate change is also not equal. And many of those whose health is currently being worst affected and in the future may be worst affected without adequate action have contributed to the least to greenhouse gas emissions and environmental degradation, which drive this crisis. And we know that colonialism is a key driver of the climate crisis, and also to the increased susceptibilities of specific population groups. And this was acknowledged for the first time by the IPCC in their 2022 report, which is very, very recent. So specific groups, including minoritized ethnic groups, indigenous people, people experiencing socioeconomic deprivation, bear a disproportionate burden of the adverse effects of climate change, particularly when we talk about health. And these disparities are very clearly rooted in historic and systemic discrimination. So now I'm hoping to talk a little bit about how we talk about climate and health. So I think these are two quite important documents for people to be aware of. So the first is an article published in the BMJ last year, which was a very clear description of how we can communicate about climate change, particularly in the clinical setting with patients. And it stressed this role of healthcare professionals as trusted advisors, as people who can listen to their patients, but also who can raise awareness of climate change as a health issue. And this is a slightly different approach to perhaps what Sarah was talking about, in talking about perhaps some of the direct impacts of the healthcare they're receiving on climate. This is talking in particular about the risks posed by climate change. And they have a role to play in providing personalised guidance and also sharing perhaps not necessarily solutions, I think that's maybe a bit optimistic, but empowering their patients to make decisions in relation to the climate in which they live. And I think it's quite interesting. I hope it'll be interesting for the talks that we have that follow today, because some of the opportunities fall in moments of what they describe touch points, as touch points. So healthcare screening, history taking, the management of longer term conditions, and also discharge planning. And although this is obviously quite a new idea and a new concept, so there's quite limited evidence on the effectiveness of this, we do know that there is obviously evidence around motivational counselling and clinician-patient communication to improve other health-related outcomes. There's also this toolkit that was published by the World Health Organization on communicating on climate change and health. And I think this is quite a powerful figure. And this is about empowering healthcare professionals to feel that they can talk about climate. And essentially, the notion here is that if you understand these 5 points, you probably know enough to be able to communicate something meaningful about climate. So number 1, that it's warming, global warming's happening. Number 2, that it's us, it's anthropogenic, it's caused by humans. Number 3, we've got a fairly high level of certainty around this. Number 4, for the most part, this is not good news for health. And number 5, with urgent action, there's hope we can fix this. So a bit now about when to talk about it. So that article that I described, it identifies specific touch points, if you like. So the first relates to healthcare screening and this idea that by asking people about their environmental history, so asking about environmental determinants of health, the most obvious and kind of politically acute, I would say at the moment, is in relation to air pollution, but there's also a lot of interest around indoor air pollution as well, and the quality of housing, for example, household mold. Touch point 2 relates to history taking. And as Sally mentioned, this idea of personalised medicine in many ways is an ancient idea, this idea that if you take a very astute and careful history, you might identify very important individual and personal factors. And again, this example focuses on someone with asthma who's experiencing a flare and asking the patient about their proximity to living on busy roads, the presence of mold in their home, and indoor air quality. And then touch point number 3, so this relates to management of long-term conditions. And this is about empowering and enabling patients to make connections about how climate change is relating and impacting on their existing health conditions. And again, this is focused on the example of asthma. More broadly, when we think about when to talk about it, I thought this is quite an interesting article which was published a while ago. It was looking at Le Monde, which is obviously a major newspaper in France, and found that although few of their articles on climate change mention health, it had been increasing in frequency, and this idea of the public health frame having increasing importance when we talk about climate to make the case for climate action clearer. I thought this was also a very interesting article which was published last year, which was around personalising climate change and looking specifically at how activists, you can see Greta Thunberg up there, who's a familiar face, how they have used social media to visualise climate action. I thought this was very interesting, this idea that social media might allow for a personalised yet universal narrative, and that you draw the individual story to resonate with broader social and political themes. And lastly, I want to talk about the moral and also to an extent legal imperative, and talk about the very tragic case of Ella Adukisi-Deborah, who was 9 years of age when she died of severe asthma. And she was living close to one of the busiest roads in London, in southeast London. And her mother is an extraordinary campaigner, a grassroots campaigner, and she successfully instigated a second inquest, which found that air pollution was a leading cause of her daughter's death. I think this is really important though in the coroner's judgment, where they emphasise that Ella's mother was not given information about the health risks of air pollution and its potential to exacerbate asthma. And if she had been given this information, she would have taken steps which might have prevented this death. And when you have a coroner's report, there is Regulation 28, which is a statutory responsibility where you believe that it's a preventable death, and they need to make recommendations which should be acted upon by relevant parties to prevent further preventable deaths. And in particular, I think point 3 is quite relevant in alignment with what I've been discussing today, which is that the adverse effects of air pollution on health are not being sufficiently communicated to patients and also to their carers, and that this really needs to be addressed at 3 different levels. So the undergraduate level in terms of how education takes place, so that's through the GMC, Health Education England and the NMC. At the postgraduate level, so this is through Royal Colleges, and then also through professional guidance. And in this case, relevant organisations are NICE and the British Thoracic Society. Just wanted to briefly talk about the local level, so some work I've been involved in at a county level in Oxfordshire. So this report was launched last year, entitled Healthier, Cleaner, Faster, and it was looking at climate action for health across Oxfordshire. And this sought to draw out local data, evidence, but also local testimonies to explore the effects that climate change is having currently on people's health, but also what it might have in the future. And you can see our Director of Public Health, like many others, identifying that climate change is a major population health threat. And these are some of the examples of the testimonies from local people, very nearby to where we are currently, explaining the impact of climate change that it's having on their health now. Thank you so much.